Good afternoon and welcome. My name is Dudley Brown Jr. I am the chairperson for the Department of Obstetrics and Gynecology at Jupiter Medical Center. And standing with me today are some of my colleagues whom I'd like to introduce. Dr. Amanda Colbert, you can wave your hand so they know who you are, Dr. Sandra Diaz, Dr. Lowell Fishman, Dr. Elise Gershman, Dr. Jeffrey Litt, Dr. Stephen Livingston, Dr. Sasha Melendi, Dr. Shai isn't here, and Dr. Samantha Winterroad. And then in addition to that, two of our reproductive endocrinologists or fertility specialists are with us as well, Dr. Jenna McCarthy and Dr. Mark Gualtieri. With the recent rise in COVID-19 cases due to the Delta variant, we've seen an increasing number of pregnant individuals with COVID-19 infection in our community and here at Jupiter Medical Center. Some of these individuals have been very ill, requiring hospitalization, intensive care unit admission, intubation, and ventilator support. Given that, my colleagues and I decided that we needed to speak to the public with a much larger or bigger platform to inform the community about the dangers and what we're seeing in the hospital affecting our pregnant and non-pregnant patients. Our community is sick and suffering, our hospitals are getting overrun, and the proliferation of misinformation is fueling what we see as vaccine hesitancy. As some of you may be aware, on August 9th of 2020, the leading organizations representing experts in maternal care and public health released a statement saying, "We strongly urge all pregnant individuals, along with recently pregnant individuals and people planning to become pregnant and who may be lactating, to be vaccinated against COVID-19. These organizations some examples were ACOG, which stands for the American College of Obstetrics and Gynecology. That's the group that most of us are members of. The Society for Maternal Fetal Medicine, or the High-Risk Obstetricians, the American Academy of Family Practice Docs, the American Academy of Pediatricians, the American Academy of Physician Assistants, the American College of Osteopathic Obstetricians and Gynecologists, the American College of Certified Nurse Midwives, and the American College of Physicians. All these organizations banded together to release that statement to strongly urge individuals to become vaccinated. Pregnant individuals are at increased risk for severe COVID-19 infection and death. With cases rising because of the Delta variant, the best way for a pregnant person to protect themselves and their baby or babies is through vaccination. As maternal care experts, we want the best outcome for our patients. The vaccine is safe and it's effective at preventing infection and severe illness. It may be given in any trimester, and it may be given when someone is breastfeeding. And this, as I mentioned before, this also applies to people who are trying to conceive. They may receive the vaccine, or people who one day want to conceive. There's an additional sort of misinformation that has been proliferating about the effect of the vaccine on fertility. So I wanted to invite Dr. McCarthy to come up for a couple of minutes and just kind of address that issue, and then we'll open it to any questions you may have.
Hi, I'm Jenna McCarthy. I'm a reproductive endocrinologist, and I just wanted to address some of the misinformation that's been out there regarding the COVID vaccine and potential impact on future fertility for both men and women. Anything that you've read or heard that suggests that the vaccine is in any way going to harm your fertility is unsubstantiated. We are not seeing that in our offices, and in infertility offices we keep very, very close track of pregnancy rates per month. So if there was an impact on the vaccine, we would anticipate that we would already be seeing it. We also know that COVID infection has a negative impact on fertility. Women who go through IVF shortly after a COVID infection have a lower number of high-quality embryos than women who have not had COVID or who have had the COVID vaccine. And men who are exposed to and develop COVID are seeing substantial decreases in their sperm counts. So I would encourage all men and women who are interested in getting pregnant in the future to go ahead and get this vaccine, protect yourself, protect your partner, protect your future pregnancy. Thank you.
Okay, would like to open it up to any questions you may have at this time.
Doctor, are there any specific or special challenges to a pregnant woman who has COVID when you're trying to treat the COVID? I mean, maybe you could kind of expound on that a little bit in terms of how difficult it may be.
Just a little.
A non-pregnant person.
Just a little. We know that pregnancy is considered a pre-existing condition, a high-risk state, just like obesity, as far as COVID is concerned. So if you get infected with mild to moderate disease and you're pregnant, your chance of progressing to more advanced disease is much greater than if you're not pregnant. And then we also know that if you get more advanced disease, you get a lot sicker than someone who is not pregnant. So I'm trying to convince my patients it's better to get the vaccine and deal with 12 hours of side effects than it is to get COVID and be in the ICU.
And there are advantages to the child too, the unborn child. I mean, what are you seeing in terms of antibodies for the unborn child in the vaccinated individuals?
There haven't been any studies that have specifically looked at that. There have been case reports of vaccinated individuals, specifically receiving it in the third trimester, who, when they checked antibodies on the baby was born with COVID antibodies, so implying some degree of protection. And there's also the assumption made that lactating or breastfeeding women who get the vaccine may develop antibodies that they may pass on to the baby. So yes, there may be some passive immunity passed on to the baby from moms who get the vaccine in pregnancy. We just don't have the data to be more definitive with our statements on that yet.
So, given all this, laying out this case, you're dealing with, I assume, intelligent individuals, right, who are trying to do the best for their family and their child. You're still fighting an uphill battle with misinformation that's overstepping anything you tell them?
So, short answer, sort of. The more nuanced answer is there are degrees of sort of vaccine resistance. There's some folks who don't believe in vaccines regardless of what the vaccine is, and they won't get a vaccine. But the folks that we're trying to appeal to are the folks that have vaccine hesitancy, either maybe because of misinformation, mostly probably because of just fear of the unknown. And so yes, we do face a challenge in breaking through the noise that's out there by educating them with actual medical data. So when we each, and so one thing I didn't say earlier is that all the physicians here represent at least 9 different medical practices in the Jupiter community, right? We're all on staff at Jupiter Medical, and so we're colleagues. So we're speaking with one voice today, but we're all in different practices, and we each speak to our patients, and we each try to educate our patients about COVID, about the dangers, and about the benefits of vaccination. But so the time that patients spend with us, we try to utilize that to educate them, but they spend more time away from us, and there is a lot of noise out there, and some of it is in fact misinformation.
When I ask a patient, have you been vaccinated, which is my opening line, I get 3 responses. Yes, I've been vaccinated, and so has my family. No, I'm still thinking whether I'm going to get vaccinated or not. What are you waiting for? And all that. And the third is they look at me like I'm trying to sell them snake oil, and no matter what I say, it's not going to matter. So if we can concentrate on the people that are just hesitant, honestly hesitant, I think we can make an impact.
So the vaccine's been available since December. Have you, even if it's a ballpark estimate, have any figures that show the number of women who've given birth here that have not been vaccinated versus been vaccinated? Is there any stats like that?
We don't have the exact statistics, but from speaking to our patients and speaking to my colleagues, the vaccination rate within our practices pretty much reflects the vaccination rate in the community. So somewhere between 40 and 50% of our patients or pregnant individuals are vaccinated, and that sort of reflects what's going on in our community in general.
Is there, obviously, you're encouraging people to get the vaccine as soon as possible if they have not been vaccinated, but is there a time in the pregnancy where you're asking people to not get vaccinated? If someone's 8.5 months pregnant, would you still encourage them to be vaccinated, or is there like a certain time threshold for that?
See everyone shaking their head.
We encourage them to get vaccinated anytime during the pregnancy.
Very good. And I wanted to recognize Dr. Anthony Shaya and Dr. Robert Chayton, who just joined us as well.
And obviously, you've been speaking about the importance of the vaccination for people who are either pregnant, want to get pregnant, men and women, obviously, but also wanted to ask, not every day do hospitals call press conferences. Why did you feel like this was absolutely necessary to get this message out, as opposed to having people get their information from the other public agencies that are trying to disseminate this information?
Well, because we're currently in a state of crisis. Our hospital is bursting at the seams. And not just Jupiter Medical, but Jupiter Medical specifically, we have a lot of patients with COVID in general, and we're seeing COVID with our pregnant individuals daily. And we have seen several, at least most of the practices here, within the last 6 weeks have had a patient in the ICU, a pregnant patient in the ICU, or recently postpartum patient in the ICU. Some of us have had patients on the ventilator. So we're in a state of crisis. We talk to our patients individually, but we figured that collectively we may have a bigger impact if we use this platform and our voices to sort of let the community know. We live, we work here, people know us, people see us, and we hope people trust us. So that's the impact we're trying to do.
Dr. Brown, is there two questions. Is there a mortality rate you're noticing among pregnant individuals at this point yet, or is that still too low? And are monoclonal antibody treatments working with these pregnant individuals?
I'll answer the first question. Dr. Little will take the second. We don't have data on a mortality rate yet. That it's probably too early, and especially here at our institution, we don't have that data. And regarding the monoclonal antibody,
So there hasn't been sufficient studies to show that monoclonal antibodies are safe in pregnancy and in lactating moms. However, and it's only indicated for the mild to moderate COVID positive individuals. Hence you can now drive up and get your monoclonal antibodies if you need to. And it's indicated in mild to moderate COVID disease in people who have the potential to go on to severe. So anybody with pre-existing conditions, and pregnancy is considered that. So if we have a pregnant patient who has mild to moderate disease, then I would strongly encourage them to get the monoclonal antibodies.
Do you have any reservations
I don't.
about getting them to?
I don't.
Pregnant? Okay.
Also, do you all get the statistics from Dr. Rastogi? He puts it out on the website, the Jupiter website, every week. And last week there were 91 patients in the hospital, and 15 in the ICU, 8 on the ventilator, and 6 on BiPAP. Okay.
How many pregnant individuals would you say were in the hospital out of that number?
At any one time, what do we have?
We have one.
You have
An
one
ICU.
now?
We have one now. We've had up to 3.
in the ICU.
We had one in the ICU last week, Dr. Shia's patient.
They're on, for over the last couple of weeks, there have been somewhere between 2 and 5 hospitalized daily. I believe you had a question earlier.
I was asking about
Okay.
the statistics.
Okay.
Do you think it's hurt the messaging that the CDC, up until recently, which is not strongly, they didn't come out with a real strong recommendation that all pregnant women should get vaccinated? They just said,
Well, American
should, but, yeah. how-
American College of OB-GYN came out with a
Anthony,
very
come
strong
up.
statement.
Come up here. Come up.
American College of OB-GYN came out with a really strong statement, and the CDC, once they evaluated the data that's out there, made a recommendation. It's very clear.
Of course, they have to see the data, and seeing pregnant patients get the vaccine is different than the general population. But once they did get that data, it's very clear. And I'd just like to make a comment to your question. You asked, why are we doing this now? We all love our job. We like to deliver babies. And to see a woman deathly sick with COVID, something completely preventable, is, we find it's unbearable, and it's something that's preventable. That's why we're all doing this. We've all taken care of very sick patients in the last few weeks, and, I don't want to see any more come through the door. It's going to happen, but we don't want to see any, we want to minimize it and, God forbid, prevent anything worse from happening.
And part of the crisis is going to be PPEs and other hospital supplies, hospital rooms, oxygen, and everything else we use here that's required for hospital admissions.
Any additional questions? Thank you. We appreciate you guys being here covering this.